Gentlemen, let's talk about something that most men avoid discussing, but that almost every man over 50 thinks about at some point. What really happens to your body when you go without sex for a while? Maybe you've been single for a bit, health issues have slowed things down, or life just got too busy. Whatever the reason, you've probably heard the saying, use it or lose it, and wondered if it's true. I'm Dr. Ada James, a urologist with 10 years of experience. Today, I'm here to give you the straight, science-backed answer. A lot of what you've heard is exaggerated, but there are real changes that happen, and it's important to understand them. Stick with me, and by the end of this video, you'll know what's fact, what's fiction, and most importantly, what you can do to stay healthy and vital, whether you're sexually active or not. Let's begin by busting some common myths I hear all the time in my office. Myth number 1, if you don't use it, it'll stop working completely. Here's the reality. Your body doesn't just shut down because you've had a break from sex. You're not going to wake up one day and find everything has permanently stopped working. Your tissues, nerves, and hormones are resilient. They adapt, and the system keeps functioning. Myth number 2, if I go too long without sex, my libido will disappear forever. This is false as well. Yes, hormones and mental factors play a role in desire, but taking a break from sex won't doom you to a lifetime of no libido. Your body is adaptive, and your desire can and will return when the circumstances change. Now here's what's true. There are measurable changes that can occur when you go without sex for an extended period. These changes aren't catastrophic, but they are important to recognize so you can take simple steps to maintain your health. Let's break this down in simple terms. No technical jargon. Your reproductive and urinary systems rely on 3 things: blood flow, muscle tone, and hormone levels. Think of these as the foundation for everything. When you're sexually active, whether alone or with a partner, you're essentially maintaining those 3 pillars. Blood flow. Sexual arousal boosts circulation to your pelvic area. This increased blood flow keeps your tissues healthy, flexible, and nourished, like watering a plant. The more circulation, the more responsive your tissues stay. Muscle tone. When you climax, your pelvic floor muscles contract. These contractions act like a natural workout, keeping those muscles strong and toned. Strong pelvic floor muscles are essential, not just for sexual health, but also for bladder control and core stability. Hormone balance. Sexual activity affects your hormones, especially testosterone, which controls desire, energy, and mood. Regular sexual activity keeps those hormonal pathways active and responsive. Now, you might be wondering, what happens if I'm not sexually active? Let's dive into that. But before we do, if you're finding this helpful, hit that like button, subscribe for more men's health tips, and drop a comment below. Where are you watching from? I love seeing men worldwide taking control of their health. Let's break down the 4 most common changes men experience when they go without sex for a while. Change number 1. Blood flow and tissue health. Your penile tissue contains smooth muscle, which relies on regular blood flow to stay healthy and flexible. When you get an erection, blood rushes in, stretching and keeping the tissue elastic. If you go a long time without erections, including the nighttime ones your body naturally does for maintenance, the tissue can lose some of its elasticity. Think of it like a rubber band that hasn't been stretched in a while. It still works, but it might feel a little stiffer at first. The practical reality. After a break, some men notice their erections feel less firm or take a little longer to achieve full hardness. The good news? This is usually temporary. Once you get back into the swing of things, blood flow improves and tissue responsiveness returns. The emotional impact. This can be concerning at first, and you might worry something is permanently wrong. But knowing this is a natural, reversible response to decreased activity can take a lot of the worry away. Change number 2, pelvic floor muscle tone. The emotional impact. It can feel embarrassing when bladder control shifts, but the truth is, This is common and treatable. It's not a sign that you're getting old, it's simply a result of inactivity that can be addressed. Change number 3. Testosterone and hormonal balance. Testosterone naturally decreases with age, but staying sexually active helps keep your hormonal system more engaged and responsive. Research shows men who remain active tend to maintain better testosterone levels, though the relationship is complex. The practical reality: after long periods of inactivity, you might feel less motivated, low on energy, or generally flat. Your libido could decrease, and as a result, you enter a cycle where less desire leads to even less activity, further lowering your desire. The emotional impact. This shift can feel like a loss of identity. Many men tell me they feel less confident or less masculine, but knowing this is usually hormonal and treatable can be a huge relief. Change number 4. Psychological and relational effects. Sex is more than just physical. It's closely tied to your mental health. Regular sexual activity lowers stress, improves sleep, and boosts mood, thanks to hormones like oxytocin and endorphins. The practical reality: long periods without intimacy can increase stress, cause feelings of isolation, and negatively affect sleep. In relationships, the lack of physical closeness can create emotional distance. The emotional impact. This is often the hardest part. Sex is about connection and feeling wanted. Without it, many men experience a deep sense of loss. Here's the key takeaway. For most men, especially those in their 50s and 60s with healthy hormones, these changes aren't permanent. Your body adapts. When you start being sexually active again, blood flow improves, tissues become more elastic, muscles strengthen, and confidence comes back. However, if you're dealing with significant testosterone decline or health conditions like diabetes or heart disease, the effects may be more pronounced and could require medical support. And that's perfectly okay. There's plenty of support available, no matter whether you're currently sexually active or not. Here are 4 practical steps you can take to maintain your health and vitality. Step 1. Stay physically active. Cardio exercises, like walking or cycling, boost blood flow throughout your body, including the pelvic area. Strength training helps keep your testosterone levels steady, and flexibility work supports overall function. Even just a brisk 30-minute walk daily can make a noticeable difference. Step 2. Practice pelvic floor exercises. You don't need to be sexually active to strengthen these muscles. Kegel exercises, contracting and releasing the muscles you use to stop urination, can be done anytime, anywhere. 3 sets of 10 repetitions daily is a solid start to keeping your pelvic muscles strong. Step 3. Consider solo activity. Even if you're not in a relationship, regular self-pleasure helps maintain blood flow, muscle tone, and hormonal balance. There's no shame in this. It's a legitimate part of health maintenance. Step 4. Get your hormones checked. If you're dealing with persistent low energy, a decrease in libido, or mood swings, it's time to talk to your doctor. Ask for a testosterone test. If your levels are low, hormone replacement therapy could dramatically improve your quality of life. While most of these changes are normal and reversible, there are some warning signs that require immediate medical attention. These include sudden, complete loss of ability to achieve erections, even nighttime ones, pain or discomfort during erections or ejaculation, drastic changes in urination, like severe urgency, pain, or blood in the urine, or persistent fatigue and depression that interfere with daily life. Pay attention to your body. If anything feels off, don't wait. Take action. Your health and vitality are worth it. Erectile dysfunction can sometimes signal underlying cardiovascular issues. If you're experiencing persistent problems, don't brush them off. Your body might be signaling something important about your overall health. Let's talk about something that's often overlooked: the emotional toll these changes can take. Many men link their sense of masculinity, confidence, and self-worth to sexual performance. So when things start to shift, it can stir up feelings of inadequacy or shame. You might even feel like you're losing your manhood or that your best years are behind you. But let me make this clear. Your value as a man is not defined by how often or well you perform sexually. Your body is simply adapting to different circumstances. With the right understanding and sometimes a few simple adjustments, you can continue to enjoy vitality and function for years to come. If you're not currently sexually active because of circumstances beyond your control, whether you're single or your partner is facing health challenges, you haven't done anything wrong. Life happens. What truly matters is taking care of your overall health and staying informed. If you're not currently sexually active because of circumstances beyond your control, whether you're single or your partner is facing health challenges, you haven't done anything wrong. Life happens. What truly matters is taking care of your overall health and staying informed. Now, let's address the use it or lose it myth. The truth isn't as dramatic as many fear. Yes, your body benefits from regular sexual activity. It helps with blood flow, muscle tone, and hormonal balance. But if you take a break, for whatever reason, it's not a life sentence. Your body is resilient, and your function can return. There are steps you can take to maintain your health, regardless of your sexual activity. The key is to listen to your body, stay informed, and never let fear or shame stop you from seeking help when needed. Your best years don't have to be behind you. With the right approach, you can preserve your vitality, confidence, and function well into your later years. If you found this helpful, share it with someone who might need to hear it, whether it's a friend, a brother, or a father. Leave a like to help this message reach more men, and subscribe with notifications so you don't miss future content. Remember, age doesn't dictate your vitality. Small, informed changes can lead to real freedom and confidence. I'm Dr. Ada James, and I'll see you in the next video. Stay healthy, stay informed, and most importantly, stay confident.